dentist quoted you thousands of dollars. Your gums are shrinking. And right now, sitting in your kitchen, there is one single ingredient that changes everything, and it costs less than $2. Before you dismiss that, before a part of your brain says, "That's impossible," or "If it worked, my doctor would have told me," I need you to give me just 4 minutes. Because what you are about to hear is not a miracle. It is not a gimmick. It is biology. And once you understand the biology, you will never look at receding gums the same way again. My name is not important right now. What is important is this. Over 60 million Americans are living with gum recession right now. 60 million, and the vast majority of them have been told the same thing. You need a procedure, you need a graft, you need surgery, thousands of dollars, weeks of recovery. And for many people, especially for women over 50, that option is simply not on the table. Not financially, not physically, not emotionally. So they do nothing, and the gums keep pulling back, and the teeth get more sensitive. And every cup of coffee, every cold glass of water, every bite of something hard sends a little shock through the jaw. And at night, they lie there wondering, is this just how it is now? Is this just getting older? I want to ask you something directly. Has anyone ever explained to you why gums recede in the first place? Not just told you that they do, but explained the actual mechanism, the actual cause. Because if no one has, that is the first problem, and it is the most important one to fix before we talk about any solution. Gum recession is not, at its root, a structural problem. It is an inflammatory problem. The tissue that holds your gums tight against your teeth, that seal, that protective barrier, breaks down when chronic inflammation is present. And chronic inflammation in the mouth is driven by something called dysbiosis, an imbalance in the oral microbiome. Too many of the wrong bacteria, not enough of the right ones. And when that balance tips, the gum tissue begins to break away from the tooth. Slowly, silently, until one day you look in the mirror and realize your teeth look longer than they used to. That is the mechanism. And understanding that mechanism changes everything. Because if recession is primarily an inflammatory and microbial problem, then surgery does not fix the root cause. Surgery reshapes the tissue. But without addressing the bacterial environment and the inflammation driving the damage, recession can, and often does, return. And your dentist knows this. Ask them. Ask them directly. Will the recession come back if the bacterial environment doesn't change? The honest ones will say yes. So, if the root cause is inflammation and microbial imbalance, what does that tell us about solutions? It tells us that the most powerful interventions might not come from a surgical suite. They might come from understanding how to reset the oral environment, reduce inflammation, restore microbial balance, support the tissue's natural ability to heal and hold. And that is where one kitchen ingredient enters the picture. Something you almost certainly already have. Something used for centuries before modern dentistry existed. Something that science has now caught up to. We are talking about raw, unfiltered apple cider vinegar, and more specifically, a precise application method using diluted apple cider vinegar as part of a morning oral protocol that targets the exact bacterial strains most associated with gum tissue breakdown. Now stay with me here, because I know what some of you are thinking. Acid? On already damaged gums? That sounds like the worst possible idea. That is a valid concern, and it is the exact objection that most people have, which is also why most people never try this and never experience the results. So let me address it completely. Undiluted, concentrated acidic substances can absolutely harm enamel and soft tissue. Nobody is arguing otherwise. But diluted apple cider vinegar, specifically at a ratio of 1 teaspoon in 8 to 10 ounces of water, creates a solution that has a pH very close to the natural optimal range for the oral environment. It is not harshly acidic. And more importantly, at that dilution, The acetic acid, the active compound in apple cider vinegar, functions as a potent antimicrobial agent specifically effective against gram-negative anaerobic bacteria. Those are the bacteria most responsible for periodontal destruction. The ones that live deep in the gum pockets. The ones that your toothbrush cannot reach and your mouthwash cannot kill. A study published in the Journal of Prosthodontics found that acetic acid in solution demonstrated significant inhibitory activity against periodontal pathogens, including Porphyromonas gingivalis, one of the most destructive bacteria in gum disease. This is not folk medicine. This is peer-reviewed science, and it explains something that people who have tried this protocol report consistently. Within days, the bleeding stops. The inflammation visibly reduces. The gums look less red, less swollen, and within 2 to 3 weeks they begin to notice the gum line looks different, looks tighter, looks like it is filling back in. Can gums actually regenerate? Can tissue that has receded actually come back? This is where it gets genuinely exciting. The answer, under the right conditions, is yes. Not in every case. Not to the same degree in everyone. But the gum tissue is not dead. It is not scar tissue. It is living tissue in a state of chronic injury. And living tissue, when the source of injury is removed and the environment is restored, has the ability to heal. The medical term is creeping attachment. And it is a documented phenomenon in periodontal medicine where gum tissue gradually readheres to tooth surfaces when inflammation is brought under control. The question is not whether this can happen. The question is what creates the conditions for it to happen. And that is exactly what we are going to walk through. The protocol is simple. 3 steps. Done in the morning, before you eat, takes less than 5 minutes. Step 1. The rinse. 1 teaspoon of raw, unfiltered apple cider vinegar. Look for the kind with the cloudy sediment at the bottom. That sediment is called the mother, and it contains the beneficial bacterial cultures and enzymes. Dissolve it into 8 ounces of warm water. Not hot, not cold. Warm. Swish this through your mouth for 60 seconds. Focus on pulling it through the back teeth, through the areas where the gum line is most affected. Then spit. Do not rinse with water immediately after. Let the diluted solution sit in contact with the tissue for another 30 seconds before rinsing. Step 2. The massage. Using your index finger, not a brush, gently apply slight pressure to the gum line in circular motions. Start from the back of the mouth and work forward. This is not aggressive rubbing. This is gentle stimulation. What you are doing is encouraging blood circulation to the tissue, which brings oxygen, nutrients, and immune cells to an area that is chronically underperfused in people with gum disease. 30 seconds per side. That is all. Step 3. The oil. Half a teaspoon of raw, unrefined coconut oil. Coat your gums with it using your finger. Do not rinse. The medium-chain fatty acids in coconut oil, specifically lauric acid, have documented antimicrobial properties and create a protective barrier on the tissue that continues working for hours after application. You can brush afterward with your regular toothbrush. The oil does not interfere. That is the morning protocol. 3 steps, less than 5 minutes. And the results that people report when they are consistent. Every single morning, no days off for the first 30 days, are genuinely remarkable. But I want to stop here and ask you something. Why do you think your dentist has never told you this? I am not here to attack dentists. Dentists are highly trained professionals who have dedicated years of their lives to understanding oral health, but they practice within a system that is organized around procedures, around interventions, around treatment codes that get billed to insurance. A dentist who tells you to use apple cider vinegar and coconut oil every morning is not generating revenue. A dentist who refers you for a graft procedure is. That is not a conspiracy. That is economics. And it is worth being clear-eyed about. There is also a legitimate medical concern about oversimplifying complex cases. Some patients truly do need surgical intervention. Some recession is so severe, so far advanced, that tissue regeneration through topical protocols alone is not sufficient. That is real. And if you are in that category, surgery may be part of your path forward. But the research is increasingly clear that for mild to moderate recession, the kind that affects the majority of people who have it, conservative interventions that address the underlying bacterial and inflammatory environment can produce results that rival and sometimes surpass surgical outcomes, especially in terms of long-term durability, because they fix the cause, not just the symptom. Here is something no one talks about. The months before surgery, if you prepare your oral environment properly, change your surgical outcomes dramatically. Even if you end up choosing surgery, doing this protocol first makes the tissue healthier, more vascular, more responsive. Your surgeon gets better material to work with. Your recovery is faster. Your results last longer. So this is not an either-or conversation. This is about understanding that you have more power over what is happening in your mouth than anyone has ever told you. And once you have that power, once you see results in your own mirror, everything shifts. Now, I want to address the people watching this who are thinking, my case is different. My gums are really bad. This probably works for people with minor problems, not for me. I hear that. And I want to tell you something important. The most skeptical people, the ones who almost did not try this, tend to report the most dramatic results. Not because skepticism is somehow helpful, but because skeptical people also tend to be thorough. They follow the protocol exactly. They do not skip days. They pay attention, and when it works, when they rinse with that diluted vinegar solution for the third morning in a row and realize the bleeding has stopped, that there is no more blood in the sink, something inside them shifts. They become believers, not in some alternative medicine philosophy, in their own body's capacity to heal when given the right environment. Have you noticed that the gum area around a particular tooth has been getting more sensitive over the past year? That when you look closely in the mirror, the root is starting to show just slightly? That is stage 1. That is the window. That is where this protocol does its most powerful work. Because gum tissue in early to moderate recession is still alive, still connected, still capable of responding. The cellular machinery for repair is still present. What is missing is the signal. And what the vinegar rinse, the massage, and the oil application do together is send that signal. Remove the bacterial load. Restore the pH. Increase circulation. Protect the tissue surface. Give the body what it needs to begin the process it already knows how to do. We underestimate the body constantly. We have been trained to go straight to the external fix, the procedure, the medication, the surgical intervention, without first asking what would happen if we simply removed the obstacle and stepped out of the way. The body is not broken. In most cases, the body is trying to heal and is being prevented from doing so by an environment that has been allowed to become hostile. Change the environment. The body does the rest. I also want to talk about diet for a moment, because what you eat between now and your next dental checkup will either accelerate or completely undermine the results of this protocol. 2 things destroy the oral environment faster than almost anything else. First, refined sugar. Not because it rots teeth. You have heard that your whole life. But because refined sugar is the primary fuel source for the pathogenic bacteria we are trying to eliminate. You cannot rinse them away in the morning and then feed them all day long. It does not work. You do not need to cut sugar completely, but cutting it significantly, especially processed sugars in drinks, packaged foods and desserts, will dramatically accelerate your results. Second, chronic mouth breathing. This one surprises people. The oral environment requires moisture and the enzymatic protection that saliva provides. When you breathe through your mouth, especially at night, the tissue dries out. Saliva is a remarkably sophisticated antibacterial fluid, Without it, the pathogenic bacteria multiply unchecked overnight. If you wake up with a dry mouth or a sore throat, you are almost certainly a mouth breather during sleep. This is worth addressing directly, and it is one of the reasons some people try everything and still see limited improvement. They are solving the daytime problem and ignoring what happens for 8 hours every night. Simple nasal strips, a humidifier in the bedroom. In more severe cases, myofunctional therapy to retrain the breathing pattern. These are not complicated interventions. They just require knowing that the problem exists. Now here is a question I want you to sit with. When was the last time someone explained your oral health to you at this level of detail? Not just, you need to floss more. Not just, we need to watch that area. But actually explain the mechanism, the cause, the path forward. I'm going to guess it has not happened often. Maybe never. And that is not a criticism of anyone. It is a reflection of how most healthcare appointments work. 15 minutes, a problem identified, a recommendation made. Next patient, you deserve more than that. And you are capable of more than that. You are watching this video right now because you are someone who takes their health seriously, who does not just accept that decline is inevitable, who still believes, even if it has gotten harder to believe, that there are answers that have not been found yet, that there is something that can actually help. I want you to try this protocol for 30 days, every single morning. Do not skip a day in the first 30 days. Track what you see. Take a close look at your gum line in the mirror before you start, and once a week as you go. Look for the bleeding to stop first. That typically happens within the first week for most people. Then look for the redness and swelling to reduce. Then around week 3 or 4, look carefully at the gum line itself. Has it moved? Has it pulled back any further? Or has it stabilized, or even appeared to advance slightly toward the tooth? And when you see results, and I believe most of you watching this will, I want you to come back here and tell us. Leave a comment. Tell us where you started and where you are now. Tell us how many weeks it took. Tell us what you noticed first. Your comment could be the thing that gives someone else the courage to try. How many people do you know personally who are dealing with gum issues right now and have no idea that something this simple and this accessible even exists? Share this with them. Not because they will believe it immediately. They probably will not, but plant the seed. Give them the information. Let them decide. Because information, real information, explained in real terms, is the most powerful health intervention there is. Before you close this video, write one word in the comments right now. Just one word. The emotion you feel when your teeth are sensitive, when the cold water hits, when you smile and feel self-conscious about how your gums look. Write that one word. Because every person who comments makes this video visible to someone else who needs it. And that one word might change someone's life. One last thing. There is a compound that works synergistically with apple cider vinegar and coconut oil that almost nobody talks about. And it directly supports the integrity of the connective tissue that anchors gum to tooth. It is not expensive. It is not exotic. And it may be the single most important addition to this protocol for anyone over the age of 50 whose tissue repair mechanisms have naturally slowed down with age. We cover that in detail in the next video. And I strongly recommend you watch it immediately after this one. Because everything we talked about today becomes significantly more powerful when you add that third layer. Subscribe so you do not miss it. And remember, your mouth is telling you something. It has been telling you something for a while. Today you finally started listening. Take care of yourself. You deserve to.